to be here today with the excellent Liz Wickham. Liz, do you want to tell us a bit about yourself?
Yeah, sure. Thanks, Polly. Thanks for the invitation. I'm delighted to be here, once again and on Friday morning. So yeah, I'm Liz Wickham. I'm married to a Moran, but Liz Wickham will do. I'm married with to a very supportive husband, I have to say, after this course. I have 5 kiddies, ranging from 12 to 4. I live in the lovely sunny southeast of Wexford. I've worked in the medical field for nearly 25 years now. I first worked as a nurse for the last 9, and now I work in the pharmaceutical side of the business. I worked in sales. I work in sales presently. I've worked in a nurse advisor post, and I've worked in a customer specialist programs for about 16 years in total. I've been in that field. It's been extremely exciting and very much self-rewarding. I suppose my goals, looking at myself, I'm a very passionate person, but I look at the best quality of care I possibly could give within my field, especially for my patients. It means supporting them with a hands-on education of disease awareness, preventive measures, and development systems and programs which with or without medication, but involving them and those and that's basically who I am and what am I about, I suppose, in my profession. And I suppose today this brings me where I am today with a mindset that if we all kind of challenge the status quo and work together, and little by little we can make a huge difference.
Yeah. Wow, Liz, you're a busy woman. You're busy at home, 5 lovely kids, busy at work by the sounds of it as well. What possessed you to do a course like this?
I suppose lots of reasons, to be honest. Personally, I suppose I wanted to develop and grow. I'm a very self-driven person, motivated and very curious. I love connecting with people to learn more and understand and what I don't know. I have a very strong belief at that, I suppose, in my profession, I suppose, in the caring side. And what the health service is trying to, I suppose, promote at the moment is getting patients to get the right care at the right time and the right place. So I felt personally, I wasn't really armed to develop like new initiatives or solutions within my own workspace at the present. So and so in order to do that, I need to support myself and getting that over the line, getting the solutions side over the line. I need to reinvent myself. I need to do something differently, to work differently, and to try and make change. I suppose set the seed in many cases. But I suppose more on the professional side, my work would talk a lot about looking beyond the molecule, beyond the medication. So I wanted to identify and develop many more key strategies to work in collaboration and joint working with other, and make like relevant value-based solutions, and develop better positive outcome from patients and healthcare workers and the healthcare system in itself. So I suppose to provide that optimal care for our patients, I needed to understand what getting into the problem space about, how to develop a solution and how to evolve that. And I suppose the biggest issue, I suppose, at the beginning is, for me, was jumping into the problem space and jumping out of it quite quickly and into the solution space. That was not working. I needed to work more looking through the lens of the stakeholders, and stop my assumptions, because me having the knowledge, I suppose, as a nurse, as I mentioned to you, as a nurse, and having the experience of that, and then having experience working in pharma as well, I suppose I had to jump out of that, and it was very difficult to do that. So I suppose I had to stop to making the assumptions when I'm looking at solutions at work. And I suppose, as you know yourself, assumptions, like it's a window. Knowing our assumptions is like to change that ideas, is looking through the windows into a different world. And if you scrub those windows, you get you let in a new light, and you see new things in a different light. So yeah, so that's basically on reflection. That's why I wanted to start this course, just to kind of to look at things differently, and how to, I suppose, structure and looking at different processes as well to get in there.
Yeah, and it's a great point, actually, Liz. Sometimes the more successful we become, the the more we build on these assumptions. And sometimes then
Mm.
in the longer term, those assumptions sometimes cloud the way we see reality, the way we see maybe opportunities, and we assume that others see what we see, etc. Really powerful. So Liz, were there parts of the program you took most from in regard to what you were aiming to get out of it?
Oh, absolutely. There's so much I learned from this course, and honestly, I'm not just saying this now, probably because you invited me on here today. But I think for me, the problem space, I'm, and you might laugh because probably you allowed me into the problem space, and I spent so much time in the problem space that you nearly had to take me out of it physically. But no, the problem space was the biggest thing. I learned so much of getting in there, delving down, going down, funneling down, and seeing my end user in a different light, and through my interviews process and surveys that I did through my project, and building that persona. But taking off, as I said to you before, taking off my nursing hat, taking off my pharma hat, and entering into this world of understanding more and delving down more. And this project really helped me in that shape, and mastered looking at the prototyping and testing when I jumped out of the problem space into the solution space, and validating that. And I think the biggest thing for me in this course is the understanding that what you're instilling and what you're trying to implement or deliver, for me anyway, in the HSC is something that's sustainable. Like, you have all these great ideas and solutions and so forth going forward, and it all looks great when you deliver it, but what's sustainable, what will continue to move, will be there, and maybe make a difference going forward within the HSC, and work out well. And I suppose as well, having that design thinking principles as well, which is transferable so much in all industries and all professions as well, to make a project successful.
Yeah, and I do remember that you got, so for a woman that wasn't comfortable in the problem space, it was hard trying to get you over afterwards. So I think obviously you're a very good learner as well, Liz. Liz, I really want to get to, because I think it really ties in nicely what you've been talking about already. The project. We all do projects in the second semester. You did a project. And it really created some, I think, waves, though, in terms of the impact it can and will have. Can you tell us a bit about that project?
Yeah, absolutely. Yeah. Firstly, is why I did this project. Like, not alone where I am working and what I'm working in, but I suppose I'm very, very passionate within this area as well. I suppose assessing the area, I suppose I assess a lot of different therapeutic areas, but in particular, I looked at the biggest pain points, I suppose, and the biggest discipline, which has the biggest concern at the moment, would be in dermatology. And then obviously funneling that down to what particular category within dermatology I was going to address. So I looked at a disease area of psoriasis. Like, literally there's 75,000 patients currently in Ireland with psoriasis, and it was like 40,000 from my research, waiting to see a dermatologist. So I just thought this was so long, extremely long waiting list, it's just soul destroying, knowing that and I have to confess to that. I have a son who has a psoriasis, which he is obviously well controlled at this stage, thank God. But yeah, he was one of those people in that waiting list. So I obviously had to drill down further and looking at certain catchment area, a certain location. So I looked at a particular catchment area, which was absolutely huge. They have about 600,000 patients feeding into this particular hospital, with a waiting list of probably even 5,000 patients. So and there was a waiting list of probably 18 months, sometimes 3 to 3 years. So I spoke very, very closely with the physicians, and we came to the conclusion that, listen, there could be something done here, but they weren't totally bought in, to be honest. They said, like, listen, Liz, you don't have the resources, you don't have the manpower behind this to make massive changes. But I just felt that there is something that we could do. So after a lot of research I presented different cases, different ideas to them, and we did come up with some ideas. And I also looked into as other countries that have had solutions to this kind of scenario, long waiting lists. It was difficult. I won't say it wasn't. But I suppose with the collaboration, the co-creation of the solution, this is why it came to fruition, and it worked so well for us. Again, as I said, I get a lot of understanding, but I worked I think the biggest key to this whole project was that I collaborated so much with them, between interviews, surveys, bringing in the primary care team into this. And it was a massive team effort. My project team was so supportive, which I sourced from outside my work. But again, they had experience within project work and so forth, which was a big help to me. But I suppose what my objective was, and I'll tell you this, the development, which was the outcome of all my research, my solution was developing a dermatologist-led online GP advice and guidance system. And then I updated the e-referral form, particularly just for psoriasis patients, and which would reduce, which hopefully would reduce the waiting times to commence treatment. So this involved using an IT system, which, bearing in mind cyber attack, this was a real spanner in the works for anything that would be trying to be implemented now or in the future. So basically, I had to use an existing system that was already in place to develop that communication between primary care and secondary care. So this was involved, basically, in a nutshell, that the primary care would email in on a very safe platform to secondary care team in dermatology, looking for advice and support in supporting a patient with psoriasis. Therefore, the lead within that department clinic would be assigned X amount of hours to address these emails. These emails will go back out to the community, go back out to the GP. They would get a lead on this. If the patient wasn't, after about maybe a window of about six or 7 weeks, or even longer, maybe 4 months, depending on the severity, the patient would see an improvement or no improvement. They would then use the e-referral form, which would be sent through the SAFE platform, that would already have been assigned for a number of years, and they would be then referred in. So that's an appropriate referral. Everything has to be done to date under the guidance of a dermatologist and under the supervision of a primary care physician. On the back of that, we found, which was great, this is really the beauty of it as well, another side of it, we found that we could use these answers as these advice and support that that has been compiled over X amount of time. We would use this as a FAQ, and this would be compiled and sent out to GPs. The clinical lead out there would have their regular monthly meetings, CME groups, and they would bring these to the group at the end of the month, and then they would have an open discussion on possible scenarios with different patients. Obviously, everything was documented and everything. So yeah, so that was like, another win for me in that side. I didn't expect that to come up, but I suppose, just to say as well, there was many challenges and lessons learned from this process. I suppose the main thing I would say is to highlight for me was the importance of the practical relevance and the use of shaping constant iterations and just involving everybody as well, and obviously the sustainability, and as I said, mentioned to you before, that's so important. So how I suppose that I would that would be supportive would be bringing the stakeholders on your journey. Everyone involved, like, it'll be patients and the clinical physicians in the dermatology units, the nurses, the primary care teams, the management in the hospital. This co-creation, collaboration, got the buy-in. I got a few early adopters at the start as well, from the get-go, and which I found was just essential.
I have to ask you, Liz, because I heard someone asking you before, how did you manage to get these really disparate groups to commit time to work together with you to solve this problem? Because you're working in a really busy environment where some would say there's lack of resources, there's maybe sometimes morale, may not be great within, sometimes within the health system, etc. How did you get this disparate group working together?
Yeah, it was difficult, I have to say. I suppose I had a bit of an advantage, I suppose, the fact that I had a nursing background, and they knew that. And I suppose those who I linked in with first, I knew they were early adopters. I knew they were eager. They were very motivated. I particularly picked one clinician that had just moved over from the UK. I knew in particular that she was open to ideas, solutions. She knew what it was like to work over in the NHS. I kind of earmarked her to look at first and talk to her. And I knew there was many nurses on the unit as well. that were eager to try different things, open to new ideas. So I suppose I marked those patients first. I flagged that I was coming in as not as a nurse, as not as part of pharma front, that I was part of working as a student in that front, and it was for UCC, and explained all this, and that was out in the open. I suppose openness is the main thing, and that built the trust straight off.
Yeah, really, really impressive to know. And Liz, something else that strikes me actually as well, you have a very busy job, but one of the advantages of doing this course online is we get to nearly know sometimes the families. We see them passing behind the camera, etc. I know you've 5 kids at home. How do they react to you doing this program, and how do they view it, and what did it have make an impression on them?
Yeah. I get that question quite a lot, funny enough, Paddy, both in my own work as well. And yeah, it was there's no point in saying it's not challenging. Of course it is, but it's a good time management. And I can honestly say that that's very much part of our life in our house. A lot of good structure, good timetable. One funny thing I will say to you is my daughter, now 10, was 9 at the start of my course, and it's not very daunting at starting off, but she said to me, Mum, she says, are you taking on too much? And I said, no, I'm not. No, absolutely not. But I suppose in one sense, right, I'm on my laptop in the evening times when I get the chance, outside my work, at the weekends, and they come up to me in the office and they say to me, Mum, we're going to such a place, and I goes, yeah, 1 second now. But on the back of that, what they see me doing, they're mimicking. I have 2 kids in primary school, one that's going into secondary school now in September, but they're on their laptops, my personal laptop, and they're up here in my office, and they're doing project work for school, and they're like 11 o'clock at night. I'm knocking at their door. I go, guys, it's 11 o'clock. You have to be in bed. And they said, oh, Mammy, we're just doing it for the project at school. We're presenting tomorrow. Do you want to look over for me and maybe finish, put in some maybe cartoonage or some animation for me or something, to make it more attractive. And I said, wow, because I often practice on my presentations in front of them, because it's great to have somebody to bounce something off, even though they're very young, but they're very honest. I have to say
that's inspiring, Liz. And yes, you are, and I know you wouldn't say that, but I'll say it, you are a role model, really. And I think, and that's why I'm going to ask you the next question as well, Liz, because there's probably maybe people listening to this, hopefully recording, saying they have busy lives. What advice or what comments would you pass in terms of that decision that they need to make about this program?
I would think absolutely, if you're this course is so open. It's for a very open-minded person, but you absolutely, you'll grow. Absolutely, there's so much benefits from this course, not just the content, but there's so much outside of that as well. Like, so many times I felt like I was drowning. The support you get in this course is, it's exceptional. It's absolutely exceptional. I think there's so much benefits in your group work. There's colleagues there from such a diverse background. There's just they help you so much. You bounce off. There's share feelings all the time. There's no stupid questions. There's no ridiculous out of this world questions. Everything. So many are actually, you're speaking on their behalf sometimes in the group, because they're maybe fear, or maybe just that they're quiet people. I just feel this course had developed me so much in myself, my confidence. I did so much presentations, so much reflections. I think I haven't done enough reflections throughout my career. Since I started this course, I'm always reflecting in practice, in action, in my experiences, and afterwards, post. I just feel that, there's the fact that you have that such a support, that nothing is daunting. As I say, I was often on a drowning phase of the amount of knowledge that comes to you. But I suppose all I would say to anyone, be disillusioned when you enter this course, start this course. There is a lot in it. The content is quite heavy at times, but I suppose if you lean to your tutors, lean to your colleagues in the classroom, it does really just benefit you so much. You know, I'm just a big believer in collaboration and speaking out and talking. But yeah, this course is absolutely has changed me so much.
Yeah, that's lovely to hear, Liz. You know, and I'd just like to say thanks as well, Liz, for coming on here, and also just to recognise, Liz, you got a fantastic result during the week, and also to point out that you very deservedly got an award for your project as well, which you've mentioned here. Liz, thanks so much.
Thank you, Paddy, and I wish you the best of luck in your future, and with any future candidates that are going into UCC. I promise